and is 25th rank in NIRF as per 2025 ranking just now announced by Ministry of Education, Government of India. As you know that ISF College of Pharmacy is one of the premier institution in pharmaceutical sciences. It is NAC A grade and conferred an autonomous status by University Grants Commission since 2017. ISF College of Pharmacy is running all the possible courses in pharmaceutical sciences, that is D.Pharm, B.Pharm, M.Pharm, PharmD, PharmD PB, PhD. M.Pharm in 8 to 9 specializations like pharmaceutics, pharmacology, pharmaceutical chemistry, pharmaceutical analysis, pharmacognosy, quality assurance, regulatory affairs, pharmacy practice, industrial pharmacy. Whereas B.Pharm, B.Pharm lateral entry, and B.Pharm practice, PharmD a 6-year course, and PharmD PB a 3-year course. Whereas we are having an excellent history of pharmaceutical education and research. We are affiliated to IKJ-PTU and MRS-PTU, which are the state technical universities. We have many accolades to our institution, like Utkrishta Shikshan Sansthan Vishwakarma Award by AICT in the year 2020. We are in platinum category as per AICTE CIA category. We are Best Pharmacy Institute in the year 2020 by ASPER, by ARIA Excellent by Band by MHRD Government of India, Most Innovative Pharmacy College in India, Best Pharmacy College by IKJ-PTU in the year 2013-14, and it is an approved center for PhD coursework by IKJ-PTU. And particularly, we are having Animal House, Herbal Garden, Human Ethics Committee, Animal Ethics Committee, auditorium, power backup, separate facilities for boys and girls hostels, meditation center, NABL accredited lab, advanced drug reaction monitoring center, etc. In the last 5 years, we have filed around 50 patents, around 2,000 publications. There are 55 laboratories. Students are coming from around 10 countries. Faculty members have written more than 65 books. There are almost 50 funded projects are going on by various reputed organizations and the agencies like DST, DBT, ICMR, etc. Various national and international conferences has been conducted in ISFCP campus. The placement record is 100%. Around 5,500 alumni are working all over the world. We have 12 technology transfer, around 200 awards to students. We have around 100 MOU and collaborations. We have 2 campus in our ISFCP. So this was a brief introduction about the institution, and I would like to thank management, staff, and all the students for this masterclass motivation and collection. And I'm thankful to foremost to all the dearest participants who have been participating in this series from all over India. We have got registration for this masterclass series. So today I will take lecture number 2 and 3 of pharmacy practice B.Pharm 7 semester. Lecture number 2 is what is the organogram of hospital medical staff involved in and various hospital pharmacy. So hospital in your lifetime, once or twice you might have visited the hospital in OPD, IPD. You have might seen the physician, nursing staff, patients. So this hospital word is originated from the Latin word hospile, means that comes where you get the hospitality. For particularly you have your disease identification called diagnosis and the treatment in OPD and IPD. So this is one of the institution or organization where your ill health get into the correct disease state of mind. So in this particular process, the term hospitals are being established to take care of sick or injured. You might see various medicos, paramedicos, nursing staffs, dietitian, physiotherapist, pharmacist into the hospitals. In hospitals, there are various kind of classifications like basis on the length of stay, clinical basis, non-clinical basis, ownership, objectives, government organizations, non-government organizations, based on the size of the hospital, management, based on the system of the medicines like Ayurveda, Unani, Siddha, Homeopathic, Ayush Mantralaya is there of the government of India. In hospital, You can work in various sectors like MRD, blood bank, pharmaceutical care services, coordination services, integration services. Specialty hospitals like cancer hospital, pediatric, geriatric, ophthalmology hospital, eye care hospital, dermatology hospitals, cardiac care hospitals, etc. You have central government hospitals like All India Institute of Medical Sciences and regional health centers hospitals. Government hospitals, particularly in the government hospitals, if you see like Postgraduate Institute of Medical Sciences, Chandigarh, Postgraduate Institute of Medical Sciences, Rohtak, private hospitals like East Coast Hospitals and Kokilaben Hospital, Tata Consultancy Hospitals, Padar Hospitals, Fortis Hospitals, etc. Public hospitals are the government hospitals where the public sector civil places are coming up in particular places. So public hospitals are the government hospitals where the civil places works on to take care of the patients. When we have corporate hospitals like Fortis Hospitals, Gratian Hospital, Asia Columbia, Max, etc. are the key players. Right now in India, Fortis is topping the chart by 11,000 beds capacity of a chain hospitals. Based on the service, if I say emergency medical services, EMRI, so in EMRI, emergency medical or casualty services, in India, Government of India has taken an initiative by GVK Reddy, a NGO of Hyderabad, and they have started 108 ambulance in all India to serve the mankind. Based on the length of the stay, so you can see acute, subacute, and chronic condition of a disease state where the emergency conditions stays up. A patient, how much time the patient takes time to get in a good state of mind. So, in particular, if I say pneumonia, peptic ulcer, so it is short length. Higher strength, length of stay, tuberculosis, leprosy, cancer, where the disease state is chronic. So long term and short term are also known as chronic care and acute care hospitals. On the basis of clinical basis, like if I say from your head neurology, then your eyes ophthalmology, then your dentistry, then mucoskeletal system, orthopedics, gynecology, cardiology, respiratory, neurology, nephrology, urology, reproductive system, gynae and obstetrics, skin and BD. So there are various departments into the hospital, and these hospitals are basically known to understand to you guys that if we are going to a hospital, we have to get some kind of medications therapy. So there are some pharmacological therapy and some are the non-pharmacological therapies. In non-pharmacological therapies like massage therapy, physiotherapy, etc. comes up. Complementary alternative medicines. And when it comes to the pharmacological, it deals with the allopathic medicines. Next comes up is based on the ownership or controlship like Tata Memorial Hospitals or someone like GVK Reddy 108 ambulance I told. So voluntary hospitals, non-voluntary Red Cross hospitals, or if you go with the UNICEF funded hospitals, charitable hospitals, nursing homes, corporate hospitals where the NABH accreditation is there and the level of the patient care is quality oriented into the corporate hospitals. So the objectives of these hospitals are nothing but to take care with the medical and the paramedical staff to well-being of a patient in medical care, in pharmaceutical care, in nursing care. They are the big bones to save a life of a patient. When we go to these hospitals where the teaching and the research together takes place, like Pondicherry, Jipmar, All India Institute of Medical Science, Bhatinda, Bhopal, New Delhi, etc. The few examples to name in the general hospitals, they provide the treatment of the common conditions. Like if you go to the primary health center, rural health center, or you go to the civil hospitals, you go to the block level hospital, tehsil level hospitals are the further classification. Hospital other specialized hospitals are also there for tuberculosis, leprosy, sexually transmitted diseases, head, eyes, ears, nose, throat for that purpose. Next is the isolation hospitals where you need to do the hospital isolation like COVID pandemic for 14 days to isolate the patient into the in that condition that centers has to be made up in the condition of epidemic or pandemic. So isolation hospitals. Next is the based on the size like 500 hospital, 200 bedded hospital. 300 is considered as tertiary care in the India, whereas 50 to 100 is considered as taluka hospital, and primary health center should have 6 to 10 beds. When it comes to the management, union government, government of India, railway hospitals, coalfield hospitals, Steel Authority of India Limited hospitals, defense sector hospitals, state government hospitals administered by state union territory, including police, prison, etc. also sometimes takes place. So we need to understand that into the various hospital setups also you govern with the things. So irrigation department, if certainly comes up in particular, or local body hospitals are administered like municipal corporation, Jila Parishad Panchayat, corporation, maternity hospitals, etc. Autonomous bodies like hospitals that are established under a special act of parliament or state legislation funded by central state governments like All India Institute of Medical Sciences, etc. Private hospitals are individual honor like 100 bed capacity or 50 or 30 bed capacity as per the Medical Council of India and NMC, National Medical Bill. As per that, you can register your hospital as registered medical institution, and definitely you can particularly work with the medicos and the paramedicos. Further, going to the voluntary agencies, all hospitals operated by a voluntary body, a trust, a charitable society, like CMC Vellore, CMC Ludhiana, or Padar Hospital, Baitul, Madhya Pradesh, etc. are the few examples to put to this voluntary system. Next comes as per the system, allopathic, Ayurvedic, homeopathic, Unani, Siddha, Chinese medicine system, complementary alternative medicines. So, like you can see one of the example of allopathic hospitals, English medicine system, then Ayurvedic medical hospitals like Amrut Ayurvedic, earlier was for the Manipal, Mahe Tiger Circle, and homeopathic hospitals like Royal London Homeopathic Hospital in the 18th century. Then the Unani Hospital, again, uh, herbal medicine for the canon of medicine. Okay, so BMS people used to take care of that. When you go to the hospitals, there are a lot of functions of the hospitals where you have to take care of the inpatient and outpatient diagnosis, treatment, man management, community health, medical camps, taking care of the health, research, diagnostics, therapeutics purposes, etc. is a vital role in this particular mental health, rehabilitation, stammering, telemedicine, injection, OPD, IPD, EEG, ECG, casualty, blood bank, medical record department, medical superintendent, nursing superintendent, chief pharmacy, pharmacy and therapeutic committee, hospital formulary, etc. takes place in an exceptional way. The rehabilitation, smoking cessation, medical education, CME, CP, research and R&D is a part of this, like robotics, artificial intelligence are nowadays embedded into the hospital setups. So the main function is the care of sick and injured, where roadside accident or any LNOPD or IPD, you have to check the patient, the client by with the healthcare system. Clients are treated according to the priorities or needs, like emergency care is provided to client with heart attack, then the client who comes with a general illness. Then prevention of disease. Prevention of disease is a prophylactic action of social and preventive pharmacy or social or administrative pharmacy, like hand washing technique, aseptic technique, vectors, or the seasonal flus where we have to take care prevention of certain complications. Promotion of health is another thing because health is an indicator of quality of life. So your personal, social, spiritual, mental, economical well-being is measured by the level of health, quality of health. In the hospitals, we have to take care with the education, supplementation, and regular checkup. Next is the diagnostics and treatment, particularly where we should understand the provisional multiple diagnosis and a confirmational or the final diagnosis, which takes care of a patient. And afterwards, when the final or the conclusive diagnostics or the decision is made, the treatment algorithm starts in a scientific application of mental hygiene and mental therapy, where it is important aspect of a healthy person. Clients suffering from stress, mental health problems are treated in hospitals. Counseling is also done in the hospital setting. Rehabilitation is the process where an individual is re-educated, particularly where an individual has been ill, injured, to enable them for becoming capable of useful activity. Like rehabilitation may be of anything, like any toxic habit, or smoking, or chewing pan masala, hookah, or liquor consumption, etc. For that, the rehabilitation, like you would have seen the movie of Sanjay Dutt, Sanju into it. He went for the rehabilitation to United States of America. So same way, like medical education, our field is ever growing. In the morning only, I got a news that WHO has included GLP-1 agonist into the model drug list of the world. And 3 weeks back, we got that ranitidine got banned from National Essential Drug List due to the presence of NDMA, which is a carcinogen and cancer-causing agent. So our field is ever updating. So you need to understand that some molecules will be contraindicated and some would be approved for the users. So we need to understand that continuing medical education and pharmacy education is the need at the hour, and has to be taken particularly in the emergency clinical conditions. Next is R&D. R&D is new thing, like we got a COVID pandemic in India 2019 worldwide. It soon become very irreparable loss to all the peoples of the life, family members, neighbors, etc., the society. So what we did repurposing of the molecule, like ivermectin, an anti-scabidial agent, was used. Acyclovir, a viral agent, antiviral agent, and this year chloroquinolins, acyclovir, then remdesivir, then the SCADA, zinc, etc. were used to treat the COVID patients. So a hospital in the modern days, no doubt, huge population, people are suffering from disease, and diagnosis has to be made. So there should be a possible place where people go, get treatment, get medicines from the pharmacy called hospital pharmacy. So a moment in a hospital setup, there are medicines, patients, physicians, laboratory technicians, medicals, paramedicals, drug distribution centers, and doses. So in a typical hospital organization, there are maze of committees, department, personnel, and services. So expert committee gave regional hospital classification, intermediate, district hospital, rural hospital, based on to the objective, general, surgical, special hospitals, teaching and research hospitals, based on the administration, ownership, government, public, non-government, semi-government, voluntary hospital, based on to the length of stay, short term, short stay, long term, long stay, depending on type of the medical staff, close staff, open staff, based on the bed capacity, small hospital, medium hospital, large hospital, based on the type of care, primary care, secondary care, tertiary care, by teaching affiliation, teaching hospital, non-teaching hospital, based on the system of medicine, allopathic, Ayurvedic, homeopathic, Unani hospital medicine system, based on the regionality, regional hospitals, district hospitals, Upjila, Union Health, Family Welfare Centers, community clinics. These are the further parts. So regional hospitals, intermediate district hospitals, rural hospitals, general hospitals, other kind of category. If we talk about special hospitals, teaching come research hospitals, government or public hospitals, private hospitals, semi-government hospitals, corporate hospitals, voluntary agency hospitals. According to the level of care, primary care hospitals where day-to-day care is given, example, Upjila Health Complex. Secondary care hospitals, it is divided into 550 to 200 bedded hospitals. The level of the care is the secondary one. Then the tertiary care hospitals comes like New Delhi, AIMS Cancer Hospital, Jawaharlal Nehru Cancer Hospital, Bhopal, infection disease hospital, mental disease hospitals included. So this institute provide referral support to primary and secondary level, where the referral of the patients are done in a atypical or chronic state where the severity of the disease illness is high. Then next comes up is the medical staff, administrative staff, medical staff, associated medical staff, supportive paramedical services, staff services. Where in the paramedics you have medics, you have physician, doctor, prescriber, residential medical officer, RMO, EMO, emergency medical officer, surgeon, dentist, ENT, cardio, derma, gynecologist, orthopedician, blood bank officer, operation room, theater staff, technician, physiotherapist, nursing staff, medical superintendent, medical record department, occupational therapist, like for stammering or speech therapy. By birth, some children doesn't used to talk at very early stage, so for that speech therapy, tongue twisters, and some people used to stammer in the public after a certain period of time. Ophthalmologist, community medicine officer, pharmacist, NHRM, National Health Rural Mission, Rashtriya Bal Swasth Kalyan Officer, Rural National Tubercular Program of India, RNTCP Officer. So Department of Pharmacy consists of hospital, clinical staff, hospital nursing staff, patients, hospital other department, hospital committees, hospital administrations. So as you know that Pharmacy Council of India gave pharmacy practice regulations, which was gazetted by Government of India at 15th January 2015. And they gave one new term called as clinical pharmacist, one pharmacist who take care in the hospital in NABH quality department with the JCI accreditation with the elements, objective and standards of care. MOM 1 to 11 is there. So they have given the definition of one pharmacist called clinical pharmacist who does not dispense but take care of the medication errors. So clinical pharmacist means an individual currently registered and who provides patient care that optimize the use of medication and promote health, wellness, disease prevention. So with the physician and other healthcare professions like clinical pharmacologist, he works. And Pharmacy Council of India in the month of February 2022 gave one amendment also that not only PharmD peoples but also M.Pharm pharmacy practice can also work as a clinical pharmacist in addition to their previous communication. So what are clinical pharmacists? They do not dispense, but they check either the molecules are given properly or not, medical audit, prescription audit, rationality chart, antimicrobial stewardship, etc. And they can get up to salary 25,000 starting to 45,000, and they have to do the clinical research, ward round, clinical review, ADRs, drug interaction, drug food interaction, patient counseling, therapeutic drug monitoring, community services, etc. And various CROs, hospitals, firms, college, universities for academia, online pharmaceutical portals and research centers are hiring to them. These are the key requirements and skills and responsibilities for clinical pharmacists. And some examples, they can work into various category into the corporate sector hospitals. When we talk about the classification or the hierarchy of the pharmacy, assistant pharmacist, chief pharmacist, associated director of pharmacist, special care division pharmacist, radio pharmaceutical pharmacist, nuclear pharmacist. So right drug, right time, right patient, right strength, and right route are the main focused component, 5 R's for the pharmaceutical care, where we are taking care of alcohols, liquors, capsules, tablets, chemicals, gallon goods, narcotic vaults, ointments, such as rubber goods, medical surgical supplies, laboratory instruments, etc. So these are the things comes up into the hospital pharmacy. So in hospital pharmacy, we do dispense a molecule, a prescription. So in that, the route, the laws, the narcotics, K drugs, H scheduled drugs, P drugs, prescription drugs, over-the-counter drugs, LASA drugs, and expired and unused medications, legal requirements. So for that purpose, a pharmacist should have in the hospital pharmacy a registered registration and the license for drug distribution, counseling, inventory. So what happens in the patient counseling, there is a purpose called as patient information leaflet. This is being prepared and particularly designed for the working in helping or aid for the patient counseling purpose. So in intramural and extramural activity in the hospital, therapeutic, diagnostics, curatives, rehabilitation, care of emergency, antenatal, postnatal services, maternity services, and family welfare like family planning, LTT camps, IP6 centers, control of communicable and non-communicable diseases, health education, etc. takes place. Another function of the hospital is to create the education, as I told earlier, CEP, CMEs are the main part, to renewal of the license to the registered pharmacist and a registered medical practitioner. Whereas in the research, you can go with the repurposing, and ever having a human ethics committee, you can go for this short drug utilization review, drug utilization evaluations, and observational studies. So the functions of the hospitals is the prevention and health supervision, rehabilitation, smoking cessation clinics. Now mobile addiction clinic has been opened by All India Institute of Medical Sciences, New Delhi. So now mobile is also counted into the category of addiction. Promotion of national health schemes like National Program for Control of Blindness, National Program for Tobacco Control, then Rashtriya Bal Swasthya Kalyan, RNTCP, Revised National Tuberculosis Program of India, etc. Health education, patient education, healthcare research, child and reproductive health, integrated disease surveillance program, nutritional counseling, diet, diagnostic and health clinical services, health screening services like capillary blood glucose, hypertension, and self blood pressure monitoring, self blood glucose monitoring via glucometer, etc. takes place. So for this hospital, the short questions are likewise: define hospital, types of hospital, role of diagnostic services, example of associate medical services, enlist therapeutic services, enlist supportive paramedical services, define term team coordinator, and allied hospitals. Long questions: functions of hospital, block diagram, supportive services, classification of hospital, services, and health scenario. Very long history, write a note on medical staff, pharmacy and therapeutic services, organizational structure of hospital, note on various types of hospitals. So now I would be starting lecture number 3, that is definition, functions of hospital pharmacy, organizational structure, location, layout, and staff requirements. So hospital pharmacy is one pharmacy located nearby the entrance of the hospitals, where you are taking the patient prescription, or you are doing the drug distribution into the inpatient department. Whereas in the outpatient department, or for the purpose of OPD, you are taking the prescription, you are handling the prescription, you are reviewing the prescription, you are dispensing the prescription, you are doing the double cross check entry, afterwards accounting, billing, and in the last point you are doing the patient counseling. So this is the main objective of hospital pharmacy: to prepare the hospital formulary, to engage yourself with the other medical and paramedical departments, to work with pharmacy and therapeutic committee, to plan, organize, implement pharmacy policy, to keep up in the procedures in keeping with established policies of the hospital, to ensure the availability of right medication, right time, right dose at minimum possible cost, to professionalize the functioning of pharmaceutical services. देखिए, what I mean to say is the pharmacist is one of the sole person dealing with the medication in the hospital. So the pharmacist should take that. The counseling is very effective department. So isolated counseling, mass counseling, etc. at the patient level is the requirement of the time. Data bank or purchase order, inventory control, indent preparation, or medications in the ambulances, medications into the crash card, medications at the various floor stock level. So typically the hospital pharmacy is of two types. One is centralized, a single store with 4 or 5 counters. Another one is floor stock system as per the body organ system: neurology, nephrology, ophthalmology, obstetrics, orthopedics, gynecology, cardiology, respiratory, alimentary system, mucoskeletal system, etc. So medicines are either stored in the stores or at floor stock level, called satellite pharmacy. And a pharmacy and therapeutic committee decides what molecule should be inside the hospitals, their order, reorder level, and their procurement has to be made up. So centralized and floor stock, as I told, as per the floor plans, as per the wards, OPD, and IPDs. Then hospitals premises, so that the patient's staff can easily go there and take up. So in the hospital, if a hospital is 500 bedded, sure there will be some 300 around. I would say that IPD, and around 6 to 700 OPD are daily. So managing 1,000 people in a day by medical and paramedical staff, and hospital has a 3 shift, 8 hour multiplied by 3. It is a ever running thing. Sunday also it runs. Okay. So infection control committee, pharmacy and therapeutic committee, then surgical prophylaxis committee, mortality meetings. There are a lot of works goes on. So medical superintendent, chief medical officer, various HODs of the medical specialties, nursing superintendents, staff nurses, as well as the pharmacy staff take care of the patient from head to toe. So in a hospital pharmacy, you have involved of the patients, clinical staff, nursing staff, hospital administrations, and particularly in and outpatient pharmaceutical services, where there are peoples for indoor and outdoor dispensing, distribution. Now we are not manufacturing, but there is one term called admixture or infusion of the injections into the normal saline, dextrose normal saline, or ringer lactate solutions. Quality control, drug monitoring, medical records maintenance, etc. Dispensing, medical termination of pregnancy register, dispensing register, manufacturing renewal license register. This all the things comes. So at an operational level in the hospital pharmacy, you are supplying the molecule, manufacturing, you are making the records of the dispensing services, pharmacy and therapeutic committee recommendation, drugs, surgical aids, storage of molecule, refrigerator should be there into it, ice lined refrigerator for vaccine storage, and maintenance of proper record, power backup facility, anti theft protection, CCTV camera, protectomat onto the floor, and providing the therapeutic drug monitoring services, establishment and maintenance of the drug information centers and poison information centers, patient counseling services, maintaining liaison with the medical and the paramedical staffs, to maintain the nursing department, central sterile supply unit in the hospital, to participate in teaching programs of nursing and pharmacy students, to maintain liaison with the medical staff, nursing, and the patients. So a hospital pharmacist has lot of services. Okay, patient flow is more. The clinical attendance in the OPD and IPD is more. So procurement, purchase order, working with research product, working with community medicine department of the hospital for medical camps, supplying indent, administrative records, expiry date records, LASA drug records, maintaining dispensing records, unused and expired medicines, disposable programs. This all are the functions of the hospital pharmacist. RPH. If any hospital pharmacist leave the job within 1 month, a new hospital pharmacist as a RPH, registered pharmacist, should join in place of him or her, and this should be reported to the Zonal Licensing Authority or Drug Inspector of the area as per the Pharmacy Act and Pharmacy Practice Regulations 2015. And hospital also have to purchase, store molecules, medicines, and also we need to do as a hospital pharmacist advanced drug reaction monitoring and reporting. For that, pharmacovigilance program of India is also governed within the PVPI. Then we need to see that to serve as source of information on drug utilization, parenterals, total parenteral nutrition, radiopharmaceuticals preparations, for diagnostics and therapeutic services, implementations of PTC, Pharmacy and Therapeutic Committee, conducting CME, CAPs, etc. So in the hospital, the drugs goes for the ward supply, ambulatory services in emergency medical services, to the casualty department, and further molecules glow at the centralized and floor stock system as well as store as well as crash carts. So there should be cold storage area, research wing, patient counseling wing, pharmacy store, library, radio, isotope preparation and dispensing area, suitable space for patient waiting zone, then display window, then waiting room for outpatients, and some utilities like for going washrooms or drinking water. Some patient education material should be over there, like there should be some leaflets or some health magazines or some televisions you can put into it. You can show the health hygiene videos so that the patient get motivated and implemented in general health of quality of life in their individual lives. Then the materials comes in narcotics, psychotropic substances, central dispensing area, patient care area where the bills accountability, and this all the things are done by the various pharmacy hierarchical staff. Where you do direct care, you see various multiple drug related problems are there, my dear students, like drug related problems concerns with adverse drug reaction, side effects, adverse effects, drug drug interaction, drug food interaction, polypharmacy, missed dose, underdose, and allergic reactions, idiosyncrasy. So this all are can be solved by the positive workflow by clinical pharmacy quality department, and it can be embedded in written by patient medication history interview, medical history interview, and patient counseling. And this all areas where you go, this is a general layout of a hospital pharmacy, where is there is the aseptic section, manufacturing section, raw material section, and in this outpatient, inpatient, drug information, quality control. So as you can see that on your screen, you can have IV admixture, unit dose, inventory, satellite control, drugs manufacturing and packaging, and various roles you have to play in inpatient, outpatient, in R&D, purchasing, inventory, dispensing, manufacturing. So that is how you can take care of the patients in your general life. When it comes to the hospital pharmacy, dispensary, preparation room, storeroom, office, manufacturing of bills, capsulation, etc. So this is the area required as per the 100 bed capacity, 300 bed capacity, and 700 bed capacity. And any person with M.Pharm, pharmacology, pharmacy practice, or PharmD diploma degree, everybody at every level are embedded into the requirement. This is the number of pharmacy requirement: pharmacist up to 50 bed 3, up to 100 bed 5, up to 200 bed 8, up to 300 bed 10, up to 500 bed 15 pharmacists are required. So Department of Pharmacy, particular in a hospital, Pharmacy takes care of patients. Hospital administration rules and laws. Jurisprudence works with the various commitments and hospital committees like Pharmacy and Therapeutic Committee, Sterile Supply Unit Committee, Infection Control Committee, Research Human Ethics Committee, etc. It works in the hospital nursing staff, clinical staff, medical, paramedical. So where we go with the hospital, pharmacy should have administrative records, like should have concern with the various drugs like narcotics, LASA, counterfeit, expired molecules, K drugs, P drugs, OTC drugs, and registration of the license, particularly drug distribution, counseling control, expired license, patient information leaflets. So, what are the rules of the hospital pharmacy? Is like dispensing, manufacturing, inventory control, teaching, statistics, reports, provide a specification for purchase of drugs, chemicals, biologicals at proper storage level, manufacturing, distribution of medications, transfusion fluids, parenteral products, tablets, capsules, ointments, dispensing, filling, and labeling of all drug containers which medicines are to be stored, then management of medications, drug information services, poison information services, discarding the expired drugs containers, and in functions of hospital, again, I am putting this slide intramural, extramural, where therapeutics, diagnostics, rehabilitatives, counseling, education, clinical research services has to be provided. So thank you so much, all the participant. And this is one of the book I have authored, and it is published by Nirali Prakashan. As per the syllabus, you can refer further for it. And I would like to thank you, Dr. Abhishek Viju Kumar, for this YouTube live. Parallel at my parallel length. And thank you all. If any questions are there, you can write in the chat box, or you can WhatsApp me or call me, and directly I will be giving the answer. So thank you so much for your patience listening. Thank you all.